I'm Dr. Greg Chernoff. I'm a facial plastic, aesthetic, and reconstructive surgeon. Welcome to my office in Indianapolis, Indiana. I've been at this for over 30 years, and it's rare that we find a new product that has instant utilization capabilities, a product that patients, without exception, love. Lipoderma is the first and only adipose replacement system that is FDA registered. It's developed from donated human fat through a very meticulous process that refines the fat cells and the surrounding scaffold matrix around the fat. And it really fits into the whole concept of a bioregenerative product. While it can volumize, it also over time integrates to the patient's own tissue. So patients see a very soft, a very natural result, and what they never want to achieve is a done look, and we never see this with Lipoderma. Its utilization on the body is really limited to the imagination of the provider. From a facial standpoint, we've used it in the temples, we've used it to fill in hollows of the eyes, in the tear troughs under the eyes, for volumizing cheeks, to help patients with their marionette lines, to refine jaw lines. And we know that probably half the world is on GLP-1 drugs, and this has been a beautiful addition to our armamentarium of treating GLP patients. The majority of these patients, as with our menopausal patients, they're losing that fine layer of fat that resides right underneath the dermis called dermal white adipose tissue. And that's what leads then to the loss of tone, quality, clarity of skin. Not only in menopause patients, but in GLP-1 patients. And so the level that we put this new product is really based upon what a patient presents to us with anatomically. We found that it's excellent for refining the skin tone, the skin quality in GLP patients, but they also lose volume. And so these patients have really loved this new product. Another very popular area of injection are aging hands. Aging hands have been always atop the list of anatomic areas that women identify as being a negative to their self-esteem. And so we'll typically use at least 1 to 2 syringes per hand, injecting in between the tendons, in between the veins, for a very, very youthful look for patients in their hands. Many of us that do aesthetic work 100% of the time do a lot of fat transfer for our patients, developing microfat, processing it into nanofat, but that requires a surgical procedure for our patients. With the advent of Lipoderma, we can now provide patients adipose replacement without doing liposuction for them. So this too has been really revolutionary in aesthetics for us. Fat is very important from head to toe because it serves as a structural support for our tissues. From a metabolism standpoint, it's integral to metabolism. And again, it acts as a scaffold, if you will, for our tissues. And Lipoderma is ideal for that because it provides instant results where you're placing it. But over time then, the scaffold aids the integration of a patient's own tissue into the Lipoderma product. And so from a longevity standpoint, this has been a really nice addition to the things that we have to offer our patients. And patients like the fact that, again, many patients come in with a concept that we refer to as filler fatigue. It's not how much filler we put into a patient, it's the precise anatomic placement of where we put any of these products. And sadly, we're seeing many providers making their patients appear like blowfish with an unnatural look, and we call that filler fatigue. And so I've converted many patients that have come to us by referral with filler fatigue to Lipoderma by first dissolving everything that they have and starting from a baseline. Lipoderma would fall into the category of a very easy product to utilize. The push on the needle is very doable. It would be probably similar to calcium hydroxylapatite coming out of the needle or the cannula, but it's a very easy push. And so we have nurse and nurse practitioner injectors as well as our physicians, and everyone without exception says to us what an easy product this is to utilize. And patients as well. The pH of the product is very closely matched to tissue, so patients don't experience that burning that they do with some of the more acidic products that we inject for them. But unlike some of the commercial fillers that are available, Lipoderma has a very natural, immediate result. We're not overfilling the way we used to with fat transfer in some patients. So they really leave with the result that they came in for. And over time then, again from a longevity standpoint, as their own tissue integrates into the Lipoderma scaffold, they'll continue to see an ongoing improvement with it. After practicing aesthetic medicine for over 35 years, Lipoderma is a product that was very easily to adopt in our practice. Patients like the story. It's all about the story for patients, and it's all about the timing of the release of a product. With apparently half of the world on GLP drugs, we are seeing dozens of patients a month come in with loss of tone, quality, clarity of their skin, loss of volume, and the addition of Lipoderma and the story behind it. It's a new story for patients, especially those patients that are tired of just getting hyaluronic acid fillers or calcium hydroxylapatite. It provides a new addition to our armamentarium. And with anything, as Lipoderma becomes more popular across the country, more patients are asking for it. And so it's very easy to adopt. It's a technique that's very easy to learn. And without exception, our patients have really appreciated the very natural and soft results that it provides without that done look. So all round, from a provider standpoint, from a patient standpoint, Lipoderma, without hesitation or reservation, has been one of the best products that I've seen come to market in decades.